Welcome. Today we are going to talk about future issues in healthcare information technology. So before we fast forward to the future, let's talk a little bit about how we got to where we're at today. In 2010, we saw the initiation of the Affordable Care Act, which really started the healthcare payment reform movement. This in turn led to where we're at today, where we're seeing the fee-for-service payment model shifting to a pay-for-performance-based model. These performance-based payment models incentivize providers to provide higher quality, more coordinated care at a lower cost, which is only going to continue to advance the need for advanced electronic medical record or EMR optimization as we move forward to the future. We can expect to see this advanced EMR optimization really start to change in two different areas. One, we're going to see it in the physician practices, and two, we're going to see it in the hospital. So first, let's talk about the changes that we expect to see in the practice. We would expect to see that the EMR will continue to be optimized by having interface with wearable technology, such as smartwatches or Bluetooth technology, such as blood pressure cuffs, which is going to help to alert the provider in real time to significant changes in the patient's status in between office visits. This data, in turn, will allow the provider to make real-time changes to the patient's treatment plan, which can help the patient to better self-manage their condition at home, thus leading to increased quality outcomes and also decreased costs of care. For patients who need to be hospitalized, research has shown that advanced optimization of the electronic medical record can actually help to decrease patient length of stay. Studies have shown that this advanced optimization increases patient outcomes due to the increased communication and coordination of care that we can see in our advanced optimization of the EMR. And these, in turn, also help to increase patient satisfaction. Despite the overwhelming research supporting advanced EMR utilization, a study of New Jersey hospitals showed that most hospitals in the state have actually not yet optimized their EMRs fully enough to achieve these benefits. The statistically significant benefits of advanced EMR utilization really do support continued advancement of EMR utilization and optimization as we move forward into the future. So we would expect to see a lot more of that. Now let's talk a little bit about consumer healthcare. The changes in payment reform over the past 8 years have led to increased adoption of the patient-centered medical home or PCMH model of care. The PCMH model is aimed at increasing patient population health, increasing patient experience, and decreasing our costs of care. So one way that providers can increase population health is through monitoring health insurance coverage for their patient population. Research has shown that patients without health insurance have poorer outcomes than their insured counterparts. And while most of our EMRs today are not equipped to alert practice team members that a patient's health insurance coverage is expiring in the near future, optimization of EMR technology in the future could help practices to put in place interventions to help decrease rates of uninsured patients, thus increasing the health of their overall population. Advanced utilization of the EMR in the future could include things like the EMR auto-generating an alert to both the practice and the patient to remind the patient when their health insurance coverage is ending soon. This advanced alert would then allow the practice to proactively reach out to the patient with resources that could help to extend their health insurance coverage without it ever lapsing, which can really help to proactively coordinate resources and likely increase patient experience as well. So when we look at the future of the electronic medical record and we look at the future of consumer healthcare, we really are talking about the growth of the role of the informatics nurse. So research and payment performance programs really support the notion that EMR technology will continue to advance and become utilized in a more meaningful way in the future. Informatics nurses are trained to help to lead this advancement. They understand the clinical importance of the EMR optimization, including increased outcomes through real-time patient treatment plan adjustment, decreased hospital length of stay, and the potential for decreasing the number of patients without health insurance. Informatics nurses are also knowledgeable about the technical side of the EMR optimization, which includes things like interfaces and security that are required if we're going to have that wearable technology or Bluetooth technology interfacing in real time with the electronic medical record. Informatics nurses also understand that poorly functioning EMR technology can actually decrease the quality of care, and a well-orchestrated implementation of advanced EMR functionality is critical to ensuring patient safety and patient satisfaction. As EMR functionality continues to advance in the future, informatics nurses will really be that integral part of bridging the gap between clinical and technical knowledge. As informatics nurses also bring the knowledge about change management theories and also about evidence-based implementation that can really help to give the most impact to both providers and consumers. So some support for the future of advanced EMR optimization. We talked about how payment reform has brought us to where we're at today and how payment reform really does support us continuing to advance our EMR technology for that better coordination of care. There's patient outcome studies that also support this and have shown that patient satisfaction data also increases. And as we've seen, the models of care, for example, the patient-centered medical home and the outpatient world, really do support models for increased consumer healthcare and the role of the informatics nurse in helping to advance that optimization of the EMR. So thank you very much for joining us today.